Discharge Instructions. The surgeon will decide when to release you from the hospital. You will need to arrange for a family member or friend to help you at the time of discharge. They will need to give you a ride home and stay with you on your first night home. You will not be able to drive yourself while on narcotic pain medication. Before leaving the hospital, a nurse will give you instructions regarding resuming your regular medications. Most often, heart, anti-seizure, antidepressant, and thyroid medications need to be continued as before. Your medication needs will be reviewed again at your 1-week post-op appointment with our office. If you are diabetic, you should check and record your blood sugars daily once you get home. If you have high blood pressure, you should monitor and record your blood pressures daily. Report these values to your surgeon on your post-op visit. It is also important to involve your primary care physician and cardiologist in your post-op care. They may also need to adjust your medication shortly after surgery as you lose weight. Fatigue and pain at the incision sites and a slightly bloated or swollen abdomen are normal symptoms. Some patients even feel like they have gained a few pounds, but this is usually related to temporary fluid retention, which is common after surgery. Do not be concerned with weighing yourself at this time. It usually takes 1 to 2 weeks for the body to rid itself of this fluid. If swelling continues to increase, notify your physician. It is normal to feel fatigued and need to rest more in the first few weeks following surgery. Some patients will feel good for a few days and then feel an energy slump. Remember that healing is taking place and your body is busy recovering in the first few weeks. If you feel tired, rest. Listen to your body. When you return to work, avoid scheduling additional activities that will add to the length of your day. Consider working a few half days when first returning to work. If you have sleep apnea and have been prescribed a CPAP or BiPAP machine, continue to use it after surgery. It will improve the quality of your sleep and your daytime energy. It will also improve weight loss. Gas pains are common in the first few days after surgery. Retained gas during the procedure can sometimes cause upper abdominal pain with referred pain to the shoulder. The best way to relieve gas pain is to move. Walking is best, but rocking in a rocking chair may also help. You can take Gas-X or Milacon as directed on the label. You may also take your prescribed pain medication. Stools may be different after surgery, and bowel patterns may differ from patient to patient. For the first few days, some patients will have soft, liquid stools because they are on liquids. Other patients may not have a regular bowel movement for 3 to 4 days. It is normal to notice old blood, black, maroon, or dark, tarry stool in the first few bowel movements. This is blood that entered the inside of the intestines during surgery and will be passed. However, the stool should not contain bright red blood or clots. If this occurs, or if you continue to have dark, tarry stools, call the office immediately. Constipation may occur after surgery. Anesthesia, pain medications, changes in level of activity, and lack of fiber in the diet can be factors that lead to constipation. You should have a bowel movement by the 3rd day after surgery. If not, or if you are experiencing symptoms of constipation like bloating, cramping, and rectal pressure, you can take a sip or two of milk of magnesia. If no results in 3 to 4 hours, you may repeat this up to 3 more times until the bowels move. If constipation does not resolve, call our office. Diarrhea may also occur after surgery. This should resolve in 2 to 3 days. If you experience more than 4 episodes in a day, treat it with Imodium. Continue to stay hydrated. Notify the office if diarrhea lasts longer than 2 to 3 days or increases to 5 or greater episodes in a day. Urination should not change significantly. Improving hydration will cause more frequent urination. Dark urine is a sign that hydration needs to be increased. Once you start vitamins, you may notice a change in the color of your urine to bright yellow. This is normal. In the first week after surgery, you should focus on the following activities. Walk frequently. Do not sit or lie down for more than 1 hour during waking hours. You may walk, climb stairs, use a treadmill, and go outside if you are steady on your feet. Be careful not to overdo it. Use pain as your guide. If an activity hurts, then stop, rest, and try again later. Patients with limited mobility must perform hourly leg exercises such as seated march and ankle rotations. Frequent movement will decrease the risk of complications such as blood clots and pneumonia and help with improving gas pains. Continue breathing exercises. Use the incentive spirometer until your first post-op appointment. You will need to perform at least 10 puffs 4 times per day. Those patients with a history of smoking should increase this to 6 to 8 times per day. Drink fluids slowly and often throughout the day to prevent dehydration. Remember, after surgery, your stomach capacity will be much smaller. Drink slowly to prevent nausea and vomiting. Your goal is to have 10 ounces every 4 hours. Accomplish this by drinking 2 to 4 ounces of water every hour that you are awake. By the end of the day, you will find you drank at least 32 ounces. It is okay if you drink more than this amount. However, if you cannot drink 2 to 4 ounces comfortably over a period of 4 hours, you must call our office. As time passes, you should gradually strive to drink 48 to 64 ounces of fluids. Do not be concerned about stretching your stomach pouch with liquid intake. You may shower as soon as you feel steady on your feet. It is important to have someone near in case you need assistance. A shower chair may also be helpful. You'll want to avoid extremely hot showers, as this can increase your chance of becoming dizzy. Wash with an antibacterial soap or Hibiclens. You may wash over your incisions gently, but do not scrub. When getting out of the shower, pat your incisions dry with a towel and put on a clean shirt. Leave your incisions open to air. Do not cover them. Do not remove the steri-strips until they have been in place for at least 1 week. It is okay if the steri-strips fall off by themselves. It is only necessary to cover incisions with gauze if they are draining. To prevent infection, do not take a tub bath or submerge your incisions in water for 2 weeks after surgery. This includes avoiding swimming pools and hot tubs. Avoid contaminated water such as lakes or ponds. It is important to take any of your medications 1 pill at a time. Swallowing 2 or more pills together may cause a feeling of the pills getting stuck. You also want to avoid lifting objects that are heavier than 25 pounds and do not perform any sit-ups or other abdominal exercises for the first month following surgery. This will allow for proper healing of your incisions. You may begin to exercise with weights 4 weeks after surgery. And it is common to feel a little weak at first, so start with light workouts and gradually increase. It is generally not recommended to drive for the first few days. Driving is not allowed while you are taking narcotic pain medication. You are considered ready to drive when you can get in and out of the vehicle comfortably, can tolerate the pressure of a seatbelt, and can perform the physical activities required for safe driving. This includes moving quickly to the brake pedal and turning to check blind spots. You may resume sexual activity when you feel comfortable to do so. Do not be surprised if pain, fatigue, and changing bodily functions influence your readiness for sexual activity. Generally, patients who can tolerate a moderate degree of exercise are physically able to resume sexual activity. Vaginal yeast infections can sometimes result from the antibiotics that are given during the surgery. Make sure to tell your surgeon if experiencing vaginal discharge, burning, and itching after surgery. If this does not resolve after being treated, contact your gynecologist. During the first few weeks after surgery, you should be alerted to changes in your body that may need attention. You should call our office immediately if you suffer from any of the following problems. If you have a fever over 101 degrees, resting heart rate that is racing or above 120 beats per minute, nausea or vomiting that prevents drinking fluid for more than 4 to 6 hours. If you have increased in abdominal pain or new onset of severe abdominal pain, lightheadedness, dizziness, or being unsteady on your feet, red, maroon, or dark sticky stools, pain in your calf muscle, unusual or increased swelling in your arms or legs, diarrhea greater than 4 times per day and lasting more than 2 days that is not relieved by Imodium, new development of a lump, redness, or swelling near the incisions, drainage from the incisions that is bloody, smells foul, changes color, or appears to be pus, incisions that appear to be opening or becoming red and feel hot to touch, decreased frequency of urination. Go to the emergency room immediately if you experience any of the following: bright red bleeding from the incisions, if you're vomiting bright red blood, bright red bleeding in your bowel movements, coughing up blood, or having blood clots in your sputum, any bleeding that does not stop, new onset of chest pain or tightness, shortness of breath or difficulty breathing while at rest and not related to any activity, changes in mental status, confusion, slurred speech, fainting, or seizures, or extreme weakness, or one-sided weakness. You or your family member should contact your surgeon if you are hospitalized for any reason. Always notify emergency personnel that you have had weight loss surgery, and always provide them the name and phone number of your surgeon. Thank you.